completed the Carolina curriculum for infants and toddlers on a 3-year-old, or he was 2 years and 10 months at the age of the assessment. Um, he was found eligible for special education in July of 2012. He's currently with the categorical identification of developmental delay. He also has a diagnosis of Down syndrome and significant hearing loss in his right ear. Currently at our school, he receives speech and language therapy, as well as physical therapy, as well as early childhood special education services. Um, he does also receive outpatient speech therapy, occupational therapy, and physical therapy as well. The current parental concerns as far as his success in school are his speech and language, and his parents are both concerned with his overall development. During the assessment, I have a very high rapport with the student. He is a student in my class. Um, we're familiar with each other. We work with each other daily, so obtaining rapport was fairly easy. During the assessments, he presented with moderate performance. His interest was easily attained. He responded to questions with average speed. However, he did require much repetition due to the hearing loss. With regards to the hearing loss, he does not work well with a hearing aid. He will take the hearing aid out of his ear and he will put it in his mouth. So mom suggested not using it. So right now we're just working with the hearing in his left ear. He also was very eager to please in the assessment. If he was unsure of an answer, he would guess, and he did that frequently. Um, Due to his chronological age as well as his developmental age, he was easily distracted. He did present with limited attention span to some of the tasks. However, to some other tasks, he did present with a higher attention span. He also does demonstrate a high need for praise, and he responded appropriately when praise was given. He didn't really demonstrate refusal to cooperate much. However, at times he did. It was infrequent, and mom said that this is a typical characteristic that she notices at home with at-home behavior as well. But his refusal in no way affected his performance on the assessment. The Carolina curriculum, I'm sure a lot of you already know, is developed for children from birth to 3 years old who have mild to severe disabilities. It includes, logical teaching sequences covering 5 developmental domain areas, which are personal, social, cognition, communication, fine motor, and gross motor. Within those domains, as far as personal and social, he was able to perform, self-regulation and responsibility, interpersonal skills, self-concept, self-help, to include eating, self-help, dressing, self-help grooming, and self-help toileting consistently at the developmental age of about 6 to 9 months. In his chronological level, in his developmental level of self-help and eating skills, he did have significant delays, which is why he does receive that outpatient occupational therapy. In the domain of cognition, he demonstrated visual and spatial skills, visual perception skills, problem-solving skills, symbolic play skills, all consistent with developmental age of 15 to 18 months, with the exception of number concepts and matching and sorting, in which these skills were limited. In the terms of communication domain, he's primarily a nonverbal student due to that hearing loss. He does demonstrate limited verbal, receptive, and expressive communication. However, he does rely mainly on gestures and signs. Based upon his nonverbal abilities and his limited verbal abilities, he demonstrated communication skills consistent with a developmental age of 12 to 15 months. In the domain of fine motor, with the exception of bilateral skills, he presented with a developmental age of 9 to 12 months in regards to fine motor. In the domain of gross motor, due to his physical limitations and his medical diagnosis, gross motor skills were consistent with the developmental age of 15 to 18 months. Overall, he presented as a happy and sociable young boy during the testing session. He made appropriate eye contact and transitioned between activities with ease. He He was generally persistent in his efforts. He attended to pictures in a storybook. He was able to sign the word daddy, and he shook his head no in response to questions during the session. He was able to place 9 cubes in a cup, take cubes out of a cup, intentionally push a toy car, remove a pellet from a bottle using directed effort, and retrieve an object through an open end of a box, and place 2 pegs in a pegboard. He also demonstrated relational play with others, for example, if he fed a baby or a doll, and he also did present ability for object permanence. He placed a square and a circle in a geometric form board. Um, the parent report on his auditory comprehension skills noted that he is able to demonstrate functional play, relational play, self-directed play, and he's able to follow a routine. And all of these skills are also demonstrated in the classroom. Um, Expressive language skills included vocalizing 2 different consonant sounds. He is able to babble 2 syllables together, and he's able to use representational gestures and use at least 5 words, participate in a play routine, initiate turn-taking games, and use gestures and vocalizations to request objects and demonstrate joint attention. Overall, from the assessment, the weaknesses that were noted were his general cognitive ability, which falls within a delayed range of functioning, and places his reasoning and problem-solving skills at the first percentile when compared with same-age peers. He was not observed to suspend a ring by a string, squeeze a toy in imitation, or remove a lid from a bottle by unscrewing. He also he did not demonstrate the ability to correctly place 3 pieces in a form board. He also did not demonstrate the following auditory comprehension skills, which would include identifying familiar objects from a group of objects without gestural cues, identify photos of familiar objects, and follow commands with gestural cues. He also was not able to demonstrate the following expressive communication skills: producing a syllable string with inflection, imitating a word, producing different types of consonant-vowel combinations, or name objects in a photograph. When provided with objects of mommy and daddy, he was able to sign mommy and sign daddy. However, he was not able to say mama or dada. Some of the goals or objectives that I think would be necessary for him to work on are improving receptive skills, at least increasing them by 6 months throughout the next year, and a couple of different short-term objectives in order to achieve that goal would be when presented with a set of 3 objects or pictures, he'll indicate the requested by pointing or vocalization or by vocalizations. 3 out of 3 trials for 2 days. Or, you can do this during snack time by indicating a preference in snack items by choosing from 2. Or also, when read a familiar story, you can point to requested items in the storybook. Certain strategies that can be used are Dr. Raver Lampman's teacher prompting, as well as the one that's used, referenced by Sandel, Hemeter, Smith, and McLean, which is systematic repetition, which he did respond very well to repetition. Another goal that would be beneficial for him to learn would be to increase expressive skills also by 6 months within the year. Another thing you could do with that is having him seek assistance during snack time with an item he's unable to open, using vocalizations or gestures, or during small group play indicating that he wants something to happen again or recurrence, which he does during snack time. He'll indicate more. He will not, however, indicate help. And also, if he's presented with pictures or objects, that he's familiar with, he'll ask, when asked, what is this, he'll be able to identify that either using vocalizations or gestures. Again, strategies to implement or to achieve those goals would be teacher prompting and systematic repetition. Also, his delays in visual perception skills could increase by 6 months within the next year. A couple of short-term objectives would be completing a 4-piece basic inlay puzzle, stringing 3 large beads on a string, and using both hands cooperatively to pull apart and put back together snap blocks. Graduated manual assistance would be a good strategy, and also teacher prompting. During this assessment, I did find that because it pretty much is, checklist, whether they can do it or whether they can't do it, I found that it was possible for me to differentiate the tasks. However, It's pretty cut and dry in the Carolina curriculum whether a student can do something or whether they can't, and then it basically gives you the developmental age that they fall into. And I did notice that pretty much throughout the entire assessment, he fell within a 15 to 18 month range. Um, Due to his medical diagnosis, some things, and the hearing loss, some things did fall, between 6 and 12 months. But overall, I think that the assessment really did help me gain a knowledge of what he is able to do, and overall, I do think that the Carolina is a great assessment um, to use to assess children with developmental delays, um, especially up to the 3-year-old age. Um, so that's about it. Okay.